PRP is a great option for early onset hair loss in both males and females. It's fast, it's easy, it's painless, and it's affordable. PRP stands for platelet-rich plasma, and plasma is kind of the special sauce, so to speak, in our blood if we have a cut. The plasma plays a huge part in the healing process. PRP has actually been used for years in medicine from a healing point of view to heal up damaged tissue, burn areas, these types of things. In the last few years, it's found its way into hair restoration. At PAI, we do a lot of follow-ups really through a 12-month period of time. So that has given us the ability to really monitor and look at guys that have had PRP done. We have magnifying equipment, microscopic analysis that we can do to actually look really, really closely at the hair follicle and the scalp to monitor the change over a period of time. The PRP process works by drawing a small amount of the patient's blood. We spin that in a centrifuge, and what that does is it separates out the life-giving platelets, if you like. In the blood you have plasma, you have platelet-rich plasma, you have platelet-poor plasma. The key part here that we're after is the platelet-rich plasma, and the spinning process will actually separate that out. You can see with Dawn moving the vial, it's very well separated. Then what we do is reintroduce the A cell. It activates the plasma and the stem cells in the body. So here's the acellular matrix being introduced. So on top, we've got our plasma, okay? And this is our platelet-rich plasma. Basically what Dawn is now doing is just drawing that off for it to be combined with the A cell. Now the key parts of the process here are the percentages that we use, the mix that we use, the speed of the revolutions. You've got to have a very good quality centrifuge to do this. The vials will be prepared. Then what we do is we take those platelets and we re-inject them into the thinning area in the top of the scalp. The top of the scalp is slightly numbed, so there's no pain to the patient. And then we re-inject every square centimeter through the area of hair loss. The great thing about PRP's effectiveness is it's not restricted to the time of the hair transplant. So we'll actually have guys that do procedures, they do a transplant, and they come to us afterwards and they say, hey Darren, can I do the PRP now? And you absolutely can. You can have had a procedure elsewhere, you don't have to have had a hair transplant with PAI, you can come to us and PRP can still be very effective for you as well. For many people, PRP may be all they need. One of the great things about PAI is we have every available hair restoration option. Something that is very important that we've seen starting to develop and change is how you pair other options up with PRP. Laser hair therapy, which is a medically safe procedure, it's FDA approved, it's a low-level cool laser light, is a fantastic option to add with PRP. They work in conjunction with each other. One is working on rebuilding cells at the base of the hair follicle. The other is working by extending the growing cycle of the follicle. So you get a 1 + 1 = 4 result with that. So for some people, they may find that they have done treatments or other options that then segue into PRP, and vice versa is also true. So the different options are so varied that we can tailor what you need based on what's best for you. The first step for anybody out there thinking about hair loss, and I know this because I've been through it myself, is you've got to pick up the phone and make that call. When you come to PAI, we are there for you, we understand. A lot of us have been through hair restoration. We're going to sit down with you in a private environment and talk to you and show you what's going on. You understand what your options are, and you also walk out of there knowing that hope is not lost. There is an option for you, and at PAI we have that.